Good day, everyone. Let's continue in our visual diagnosis. Let's talk about eye shape. Inspecting the shape of the eye, also called appearance of the eyes. This refers to the outward appearance of the eye shape. The normal shape should be the same size on both sides. There is no swelling or ulcers on the eyelids. The eyelids open and close easily and flexibly. The clinical significance change in the shape of the eyes usually reflect the state of qi, either excess or deficiency, and the pathogenic factor, heat or dampness, etc. Pathomechanism. Normal eye shape requires the nourishment of qi, blood, and body fluids, as well as the normal functioning of the muscles and sinews to support the eyes. Position in the skull. If qi, blood, or body fluids are insufficient due to an attack of exogenous pathogens or Zangfu organ deficiency, then the eyes and the muscles in the sinews around the eyes will lose nourishment and support, which will cause the eyes to sink inward. Okay? If an accumulation of excessive pathogen fights with the exuberant antipathogenic qi, this can push the eyeballs outward, leading to exophthalmia. Dampness may also accumulate around the eyes, giving rise to local swelling. This is the pathomechanism of pathological eye shape. Okay, let's talk about the abnormal eye shape. It comes from the exopathogenic attack and Zangfu organ dysfunction. Also, the abnormal eye shape, if this sunken the eyes, this is the loses nourishment and support. Okay, and the other side, the abnormal eye shape, if heat accumulates or damp accumulates, they result swollen eyes. So, exuberant antipathogenic qi struggles with excessive pathogens. Qi pushes eyeballs outward. It results the bulging of the eyes. Okay, as you can see in the picture, let's talk about pathological change of eye shape and their indication. Exophthalmia, also called bulging eyes. This refers to the protrusion of patient eyeball on one or both sides. Exophthalmia usually indicates a condition of excess. Okay, bulging eyes and their indication. Okay, the description of protruding eyeballs, headache, red tongue, yellow greasy tongue coating. It indicates the liver-yang rising. If protruding eyeballs with dyspnea or asthma with an inability to lie flat, palpitation, it is an indication of lung qi stagnation. Okay? Protruding eyeballs with swelling in the neck. Okay, with distension, headache, and dizziness, irritability, easily angered. It is an indication of qi stagnation with heat. Dizziness, tinnitus, 5-center heat, red tongue, scanty coating. It is an indication of yin deficiency with relative yang excess. With headache, diplopia or double vision, purple tongue, body with spots on the lateral margins, this is an indication of qi and blood stagnation. Okay, letter B, sunken eyes. Yes, you can see in the picture, sunken eyes means that the eyeball has something deeper into the eye socket. It usually indicates a condition of deficiency. Sunken eyes and their indication with the description of following severe or chronic illness, the eyeball gradually sinks deeper into the eye socket. It indicates the qi deficiency. If sudden onset of sunken eyes follows severe vomiting, diarrhea, or loss of blood, it is an indication of spleen-qi, spleen deficiency with liver excess. With chronic or critical condition, the eyeball sinks inward relatively deeply, suggests unfavorable prognosis. And it is the indication of yin and yang depletion. Okay, next. Letter C, swollen eyes. As you can see in the picture, swollen eyes means that the eyelid, the upper, lower, and or both is swollen. As you can see, it may be accompanied by redness and wet skin. It usually indicates dampness or water retention. Swollen eyes and their indication, sudden onset red and swollen eyelids, pain and itching, may include open sores. It is an indication of wind heat toxin. If redness and swelling with itching or slight pain, recurrent attacks, none of symptoms are severe. It is an indication of latent heat in the spleen. Okay? If there's a puffiness without pain, shiny eyes without color change, it is an indication of edema and water retention. Okay. Slow swelling of the eyelid without pain or inflammation, visible on both upper and lower eyelid. It is an indication of spleen deficiency with damp. If there's a bugs beneath the eyes, it is an indication of spleen and kidney deficiency in the elderly. Okay. Number 4, inspecting the bearing of the eye. Also called the state of the eye. This refers to the movement and bearing of the eyeball and eyelid. Normal eye bearing means that the pupils are of equal size, 3 to 5 millimeter in diameter, and are responsive to light. In general, movement of the eyeball should be flexible and agile. In clinical significance, inspection of the eye bearing can help to identify the thermal nature of pathogens and their pathogens. In pathomechanism, normal eye bearing depends on the normal functioning of the muscle and sinews. Therefore, abnormal functioning of the muscle, spastic or flaccid, and sinews with spasms are the pathomechanism of pathological eye bearing. Spasm of muscles or sinews can be due to either exopathogenic attack, wind or heat, or to qi and blood deficiency, where the muscle and sinews lack nourishment. Flaccidity of the muscles and sinews is usually due to some organ dysfunction, okay? Especially the kidney and the liver. Okay, this so we can see pathomechanism of pathological eye bearing. Okay. Exopathogenic attack and some organ dysfunction may result dysfunction of the muscle or the sinews because of the abnormal eye bearing. Okay, either eyelid drop because of the muscle sinews become flaccid. Okay, the other one, the muscle sinews and spasm, it can cause the strabismus, eyelid twitching, deviated eye. Okay. Okay, letter A, strabismus. The pathological changes of eye bearing and their indication. The eye cannot look straight or deviates to one side or the other. This can happen in one eye or both sides. The bismus and its indication. Okay. Sudden onset, usually upon arising from sleep. Eyeball deviated to one side, no redness or swelling. Usually happens in only one eye. May be accompanied by deviated mouth, headache, dizziness, and aversion to wind. This is an indication of wind attack in the collaterals. Okay? Next, if the description is sudden onset, eyeball deviates to one side and is difficult to move, usually happens in one eye. Accompanying symptoms include nausea, vomiting, fatigue, tightness in the chest, visitant coating, slippery pulse. It is an indication of damp phlegm obstructing the collaterals. Okay, next. The description is both eyeballs deviate to one side or upward, high fever, headache, possible coma, convulsion, red tongue, wiry rapid pulse. Okay? It is an indication of wind heat flaring upwards. Okay, next. If unilateral or bilateral deviation of the eyeball, red color, sclera, accompanying symptoms include headache, bitter taste in mouth, irritability, numbness in the limbs, and with the wiry pulse. It is an indication of liver wind. Okay. Onset following traumatic injury, it is an indication of blood stagnation. And lastly, if the description is congenital onset, unilateral or bilateral, sometimes with delayed development and mental retardation, it is an indication of benign birth defect or essence deficiency. Okay. Okay, letter B, eyelid spasm. You can see in the picture, eyelid spasm also described as eyelid twitching. This refers to the involuntary unilateral spasm of the eyelid. It may also radiate to the eyebrow. Eyelid spasm and their indication. Okay, if the description is frequent involuntary spasm, dry and itchy eyes, pale face, and lips, steady pulse, it is an indication of, remember, blood deficiency. Okay, the eyelid spasm with frequent blinking, eyelid feels heavy and tired, poor appetite, fatigue, flabby tongue. It is an indication of spleen and stomach-qi deficiency. Lastly, if the description is occasional eyelid spasm, red, painful, or itchy eyes, may have sore surrounding eyes, may be accompanied by headache, fever, chills, and with the floating pulse. It is an indication of wind heat attack. Okay, letter C. Eyelid drop. You can see in the picture, also known as blepharoptosis. This refers to the dropping of the upper eyelid and difficulty in keeping the eye open completely. The upper eyelid may block half of more of the eye. Okay. Okay, the description. If the description is slow onset, patient reports difficulty in keeping eye open, may be accompanied by fatigue and organ prolapse. It is an indication of qi sinking. If there's an acute onset, upper eyelid suddenly drops, may be accompanied by local itching or numbness. It is an indication of wind attacking the collaterals. And lastly, the eyelid. If the eyelid drop, usually following traumatic injury, it is an indication of qi and blood stagnation. Letter D, platycoria. Okay, as you can see in the picture, platycoria refers to dilation of pupils. Okay. where the diameter increased to more than 5 millimeter. It usually indicates exhaustion of the kidney essence, which fails to pour upward to the eyes to contract the pupils. It usually a sign of terminal stage of disease. It is sometimes seen in glaucoma patients as well. Okay, letter E, you can see in the picture, this is an meiosis. Okay, meiosis refers to contraction of pupils. Okay, the diameter of the pupils decreases to less than 2 millimeter. It usually indicates flaring up of liver and gallbladder fire. Meiosis may also indicate an overdose. Okay? Or poisonous mushrooms. Thank you for your attention to everyone.